This is the VOA Special English Health Report. Governments, businesses, and other groups have promised to add $3 billion to the fight against malaria. The promises came last week at a meeting at the United Nations in New York. The money will support a new global malaria action plan. The plan aims to stop the disease in Africa by 2015. Malaria is not limited to Africa, but 90% of deaths happen south of the Sahara. British Prime Minister Gordon Brown said the plan will not only support bed nets, but research, cutting drug costs, and expanding healthcare systems. Governments and international groups spent $1 billion on malaria programs last year. But the Roll Back Malaria Partnership says the world should spend more than 5 times that amount. It says doing so could save 4 million lives by 2015. The partnership includes United Nations agencies, the World Bank, and leading drug makers. Earlier this month, the World Health Organization released its World Malaria Report for 2008. The report presented sharply lower estimates of malaria cases than in the past. WHO officials say the corrections were mostly the result of better methods of collecting information. Until now, the agency has said there were as many as 500 million infections every year, with 1 million deaths. The new report estimates the number of malaria cases in 2006 at about 250 million, and it estimates the number of deaths at 881,000. The great majority who die are young children. The WHO says the old numbers came from using malaria maps from the 1960s. But changes have taken place, including the movement of people to cities, especially in Asia. The disease is less common in urban areas. The report says malaria deaths have decreased in several countries, and a few African nations have reduced deaths by half. Yet the malaria drugs needed for what is known as artemisinin-based combination therapy reached only 3% of African children in need. In the last 2 years, though, there have been greatly increased efforts to provide families with bed nets. These nets are treated with insecticides to kill the mosquitoes that spread malaria. Campaigns for indoor spraying of insecticides in homes have also increased in Africa and elsewhere. And that's the VOA Special English Health Report, written by Katie Weaver. For more health news, go to voaspecialenglish.com. I'm Jim Tedder.